Hi there. Welcome to the HealthAnalyticInsights podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health analytics. I hope to share information and advice in topics such as health informatics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast episode, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast. And without further ado, let's get into it. So in this podcast episode, I want to talk about the battle between predictive versus prescriptive analytics in healthcare. So what are these tools, and does one have a better use case than the other in healthcare? Let's discuss. And as always, I would love to hear your feedback as well. So again, there's many definitions of predictive analytics. It can be described as using statistical modeling to predict an outcome. It can fall under using past historical data and machine learning techniques, such as decision tree classifiers or neural networks, to train a model and then use this model to predict an outcome with this past historical data. So predictive analytics has been used and continues to be used in several industries, such as the financial industry to predict cases of fraud detection. It's also used in the insurance industry to predict insurance claims that customers might submit and how much payout would be needed to cover this claim. And although predictive analytics as a whole is quite new in the field of healthcare, there are potential benefits such as predicting readmission rates for patients and predicting which patients might be at risk for breast cancer. In Canada, in a study done in 2019 by the Canadian Institute for Health Information, this study reported that 1 in 11 patients are readmitted within a month of leaving the hospital. And readmissions cost more than $2.1 billion a year. Being able to flag patients who might be at risk for readmission before they leave the hospital and improve patient monitoring after when it comes to follow-up care might result in significant savings in the future. So this might be a good use case when it comes to applying predictive analytics. On the other hand, we have prescriptive analytics, and this can be described as using data-driven decisions to output several outcomes and determine what should be done. So in my opinion, I believe the main difference between these two types of analytics is that predictive analytics is focused on oftentimes just predicting one outcome. For instance, a breast cancer risk scoring tool can take into past clinical history of patients, and then using the machine learning tools, it will estimate your risk of developing breast cancer. This might fall under predictive analytics. Whereas with prescriptive analytics, the output might be a range of options. And then from this range of options, you might choose the best option. So for example, Google's self-driving car would be an example of prescriptive analytics because the car is being operated based on taking in new information continuously as it travels to areas where there are crowds of people, buildings, traffic signals, and so on. And then it makes the best decision based on these inputs of whether to turn right, left, or keep on going straight, and so on. So I visualized prescriptive analytics kind of as a feedback loop, constantly taking in relevant information to influence a final decision, where I see prescriptive analytics as more of a straight line. You have your historical data, you train your machine learning model, and then use this historical data and predict a final outcome based on your testing data set. So in my own master's research, I use predictive analytics as I analyzed a data set which consisted of maternal factors. I trained a machine learning model using decision tree classifiers and artificial neural network classifiers. And then I used a test data set to predict how likely certain patients would be at risk for premature birth. So although applying prescriptive analytics to the healthcare field is newer than even, say, predictive analytics, there might be far-reaching benefits. If we go back to the example of hospital readmission rates, which I stated at the beginning, instead of just flagging patients who might be at risk for a readmission, wider-scale intervention programs could be developed with several options such as linking up high-risk patients with physicians, providing patients who might be at risk with a hotline to contact the hospital, and advanced care for these patients, and analyzing which of these outcomes is the most valuable. Is it linking up the patient with a physician? Is it providing the patient with a hotline? Or is it providing more advanced care? But of course, we always have to weigh the cost of this. As I said before, in the study done by the Canadian Institute for Health Information, hospital readmissions cost more than $2.1 billion. So we have to balance if applying these prescriptive analytics tools is a beneficial intervention technique. Nevertheless, in my own opinion, I think that prescriptive analytics will be of more value in the future over predictive analytics in healthcare organizations. Because I think one of the drawbacks with predictive models in healthcare is a lack of explainability and potential black box models that are the foundation of some predictive models, specifically neural networks. I think that if patients and physicians want to have predictive models integrated into their medical diagnosis, physicians will have to explain these complex mathematical models to patients in a way that they understand of how this tool is impacting their diagnosis. And I think this might be a barrier to usage. Whereas I think with prescriptive analytics, because it is a more integrated model where the clinician is able to provide their own input when it comes to building the model, and is presented with a range of options, it's more of a physician or clinical decision support tool, as the clinician uses their own knowledge and background to present the best option to the patient. And I think this model might be a more sustainable and better option. But as always, it will be interesting to see how analytical models, whether it be predictive or prescriptive analytics, can help improve organization and patient outcomes. So I hope you enjoyed this podcast episode about the difference between predictive versus prescriptive analytics in healthcare and my own opinion on how I think that prescriptive analytics is the future. So what's your opinion? Do you think that predictive analytics is better than prescriptive analytics? Do you think that there's room for both in the healthcare field? Let me know at HealthAnalyticInsights@gmail.com. Of course, this podcast is focused on building a community of students and professionals who are interested and have experience in the field of healthcare analytics and healthcare informatics, so we can grow from each other. So send me an email if you have a topic you'd like me to discuss, or if you'd like me to do a deeper dive into predictive versus prescriptive analytics. Please follow this podcast if you're interested in seeing more of this content, and have a wonderful day.